Hello everyone. If you're preparing for the ADEX Dental Board exams between January and July of 2026, there are some major updates that you need to be aware of. While the perio, endo, and prostho sections are pretty much the same, there are significant changes in the restorative section. First of all, it's the order of the exam. Before, the order could be variable. You could do posterior before anterior or vice versa. But now they're going to have you do the anterior first and then the posterior. Also, the timing has changed. Before, you had about 7.5 hours to do both procedures, but now they've split it. So you have 3 hours to do the anterior, 3.5 to do the posterior. You must complete everything in the anterior section before moving on to the posterior, and the time cannot transfer over. So you have to really focus on the anterior section first, finish that, then focus on the posterior section, finish that. Now let's look at some clinical changes, specifically the pulp management. So before, what used to happen is when you were approaching the pulp, you could ask for an indirect pulp cap and then place an indirect pulp cap material. But now that is completely gone. There is no more indirect pulp cap. So what needs to happen now is if you find a direct pulp exposure, you need to stop what you're doing and you need to submit it through this tablet system, which I'll talk about later. And let them know, hey, I have a pulp exposure. They're going to look at that and then they're going to give you the okay continue. We accept your pulp exposure. Then you're going to complete your prep, and then from there you're going to submit it for grading. You are actually never going to place a pulp cap. So the pulp cap placement is completely out. You just have to be able to identify a direct pulp cap and immediately report it once you find it. Now, these teeth are plastic. So there's a different type of plastic for the enamel. There's a different type of plastic for the dentin. And then right in the middle, it's more like a wax that's kind of representing the pulp. Sometimes between the enamel and the dentin plastic, there are little bubbles or voids. I've had students who have thought that that was the pulp. That is not the pulp. You need to understand the pulp is more towards the center. I made a whole YouTube video about how far the pulp is from the cavo surface margin. It's about 3.5 to 4 millimeters. Please watch that video. If you're not sure, go ahead and perf some teeth yourself so you can understand where the pulp is and you don't confuse those little bubbles that can happen at that kind of intersection of those two types of plastic. So be really careful, because if you misdiagnose a pulp exposure, so if you say that it's a pulp exposure when it's not, or if you fail to recognize a pulp exposure, so if you are in the in the waxy plastic and you don't realize it's a pulp exposure, both of those are a fail. Finally, there is a change in the diagnosis of the lesion. So before you start your restorative exam, they actually show you an x-ray and they want you to diagnose where is the lesion that I'm going to be working with. So before you had 3 shots at this, now it's only 2, and starting in August, it's going to be just 1. So basically what you have to do is on the first try, if you misdiagnose the lesion, so if it's like 7 ml and you say it's 9 DL, then that's a 15-point deduction. On the second try, if you misdiagnose, it's 100% deduction. So be really good about being able to identify where the lesions are. To be honest, this is not a usual problem that people have, but be extra careful on this step. Finally, there's the communication between you and the floor instructors or the graders. So before, you had a paper form, you would fill it out, your floor instructor would sign off, and then you would go on to the next step. You're still going to have that piece of paper, but now you have to submit it through an electronic system. You can use the paper to take notes, but then when it comes to submitting, like, oh, I found a pulp, or I found caries, I want to ask for an extension, you have to submit it through this electronic system, which is basically a tablet system. I don't think this is a big change, but just be aware of these little tweaks. Sometimes these little things can throw us off during a high stress situation. So These are the changes coming up if you're taking the exam between January 1st and July 31st. Starting August 1st, there's going to be more changes, and I'll create videos for all of those changes. So stay tuned.